Whether you've had a laser eye surgery done or not, it's so cool to learn all of the different ways that lasers can be used to treat eye conditions. And if you are preparing for a laser eye surgery or you're deciding between LASIK and other options, this video can help you know what you're looking for. By the end of this video, you'll have an idea of what options are out there. It's an important distinction to make which laser procedure you've had because they can happen on many different parts of the eye and treat many different conditions. So knowing your eye history can really help you if you ever see a new eye doctor to save time looking through old medical records and get you treated more effectively and efficiently. With that, let's get started. Laser actually stands for light amplification by stimulated emission of radiation. And basically what that means is that the light is concentrated into a really thin beam, and that gives it a lot of power to do really cool things like cut through tissue. This is how it can be utilized in various eye procedures. Let's start from the front of the eye and work our way back. Let's start with the cornea, talking about refractive surgeries. These are the surgeries you're going to have done if you're unhappy with your vision without correction and you don't want to be wearing glasses or contacts anymore, or maybe even want to become less dependent on them. The most famous one, of course, is LASIK. This stands for laser-assisted in situ keratomileusis, which means it actually stands for light amplification by stimulated emission of radiation assisted in situ keratomileusis. So yeah, I'm glad we just call it LASIK. What happens in LASIK is it creates a flap of the outer layer of the cornea, the front of the eye, so that can be folded open to then apply a laser to change the shape of the cornea, and that will change somebody's prescription, or I guess take away their prescription so they no longer need one. Now, LASIK is not to be confused with LASEK with an E. This one stands for laser subepithelial keratomileusis. This is different from LASIK in that a laser is not used to create that corneal flap. Instead, a solution is used to loosen the corneal epithelium, and that's pushed to the side so the laser can then be used to treat the cornea and change that prescription, and then the epithelium is pushed back onto the cornea and allowed to heal. Done more commonly than LASEK, but less often than LASIK, is a procedure called PRK, which is photorefractive keratectomy. This is different because the outer layer of the cornea is removed, a laser is used to apply the treatment to the cornea to change the prescription, and then the cornea is allowed to grow back and heal. This might sound a little bit scary, but there are actually some benefits to doing it this way compared to the way that it's done with the flap in LASIK. SMILE is a newer laser procedure that's done to change the prescription of the eye, and that stands for small incision lenticule extraction. Basically, a smaller incision is made rather than a large corneal flap, and a laser is used on the front and back, and it lasers three-dimensionally to make this lens-shaped piece of cornea that is then removed through that small incision, and the new shape of the cornea will correct for vision. So all of these aim to correct for vision and make people less dependent on their glasses. Our final corneal laser procedure for today is different from the others because it's not a refractive procedure to correct vision. It's actually used to correct corneal irregularities. It's called PTK, or phototherapeutic keratectomy. This is used to treat things like corneal scars, corneal dystrophies, and recurrent corneal erosions, which if you've ever scratched your eye and had it heal, and then you wake up in the morning and that wound has reopened, that's what I'm talking about here. This procedure can help to correct those issues in the cornea to try to prevent that wound from continuing to reopen. Let's move back in the eye to the iris and ciliary body area. Here we're talking about treatments for glaucoma. In the case of an LPI, or laser peripheral iridotomy, a laser is actually used to create a hole in the iris. This procedure is often done as an emergency treatment for somebody who is suffering from a glaucoma attack. I think when most people think of glaucoma, they think of a disease that happens really slowly over time and it doesn't cause any pain. There aren't symptoms early on, but there actually is another type of glaucoma where the angle of the eye is narrow and that angle can fully close, meaning the fluid can no longer flow out. So the fluid continues to be produced, but it doesn't exit the eye, and the eye pressure builds up super fast, and it's very painful, and it causes halos around lights, even nausea, bad headaches, and it needs to be treated right away, it's pretty typical to have permanent vision loss within a few hours if this goes untreated. So in this case, the laser is used emergently to poke that hole through the iris so the fluid has another route to go through so the pressure doesn't spike up and cause this permanent damage to vision. It's also used prophylactically in someone who has narrow angles and might be at risk for one of these glaucoma attacks. That hole is lasered there ahead of time to give that extra pathway for fluid so this doesn't happen to begin with. There are a couple laser procedures used for the other kind of glaucoma where the angle is open. In this glaucoma, the trabecular meshwork where the fluid is supposed to flow out through just doesn't work as well. So an argon laser trabeculoplasty is used to create kind of larger holes in that meshwork to let the fluid flow out faster. And then selective laser trabeculoplasty is a different type of laser, and this is more used rather than creating larger spaces. It aims to stimulate the tissue to function a little bit better at doing its job. The ciliary body is the part of the eye that creates the fluid that sometimes builds up too much in glaucoma. So in some cases of severe glaucoma where other treatments are failing, cyclophotocoagulation can be used to laser the ciliary body to slow the production of this fluid. This is where it can get kind of confusing because this procedure can be done at the same time as cataract surgery, sometimes confusing people into thinking that they had some sort of laser cataract surgery done, but it's actually a laser procedure to treat glaucoma while the cataract is also being removed at the same time. Speaking of cataract surgery can be done without the use of a laser, but there is a procedure called femtosecond laser-assisted cataract surgery, where a laser is used to help to make the incisions and to break up the cataract. It can also be used to correct certain amounts of astigmatism if that's necessary as well. If you've already had cataract surgery and some of those familiar cataract symptoms are returning, like blurry vision, halos around lights, difficulty driving at night, you could have a posterior capsular opacification, which is pretty common. Basically, that thin layer that used to hold your lens in place but now holds the intraocular lens implant in place gets a little bit cloudy over time. Fortunately, now we can use a laser to poke a hole in that cloudy area so you can see through it. And this is called a laser capsulotomy. Fortunately, after a laser capsulotomy is done, it's pretty rare for it to need to be repeated in the future. So once you've had cataract surgery and then a capsulotomy, it's not likely for that area to get clouded again. Moving back behind the lens is the vitreous gel. Floaters are a common complaint among many generations of people, myself included. If you've ever swatted at a gnat that isn't there or seen cobwebs in your vision, you probably know what I'm talking about. The vitreous gel is full of floaters. There's a laser procedure called laser vitreolysis that can be used to zap those large floaters and break them down. But sometimes this can create more smaller floaters, so that's always something to consider if you're thinking about having this procedure done. At the very back of the eye, we have the retina. This is a location where laser is utilized in a lot of different ways. Pan-retinal photocoagulation is something that's done in diabetes or other conditions that can cause bleeding in the eye. This can be used to scar the peripheral retina, which isn't responsible for vision, to reduce oxygen demand, to reduce the development of new blood vessels that can leak really easily and cause bleeding in the eye. It can also be used to tack areas of bleeding and to slow down swelling. This is also important in certain macular conditions where there's either bleeding or swelling in the macula. Lasers also do an excellent job at treating retinal holes, tears, and detachments. I like to think of it like a welder tacking down around that hole so that it doesn't spread and affect other retinal tissue. Don't forget to subscribe so you don't miss out on any eye or vision related videos. And go ahead and watch this one next. Thank you for watching, and I'd love to see you next time.